right now, where Charlene St. Nicolas is one of the wonderful people that has been working super hard, not just during the pandemic, but especially during this very awkward time. And Charlene and her team have been doing the good work that they are doing as the Actor Senior Citizens Administrator for a very long time, taking care of our island's beloved Manomko, our elderly, the people in our community that we cherish so much. We have so much reverence for them. Charlene, first of all, Hafaday, and welcome to the show.
Thank you. Thank you for having us on and to talk about Senior Citizens Month. I also, if I may, just want to bring out that it is still Public Health Awareness Week. And while I'm on with Chris and yourself, our team is also doing virtual live on Division of Senior Citizens Services. So starting at 9. So if I can just plug on a little bit there. So
sure.
Within the division, so today's 9 o'clock to 10 o'clock is on Division of Senior Citizens Aging Services. At 10:30, we're going to have a topic on APS presentation. The DSC service presentation will be presented by Chad Palomo, who's a program coordinator with the division. The 10:30 presentation on APS, Adult Protective Services, will be presented by Evelyn Manabusan, our Social Service Supervisor 1. Our 2 o'clock presentation will be presented by a Management Analyst 4, Erica Tyron, and Daryl Dearest, Program Coordinator 3 on Elderly Nutrition Program. And that's our, so we've got like multiple things happening today. And I don't have the Zoom link. I can forward it. Oh, no, I do. The meeting ID.
Oh, yes, please.
925-5626-806. I'll repeat it again and I'll forward you the flyer.
Okay, thank you.
925-5626-8606, and the passcode is DPHSS. So that's DPHSS. If you can,
We'll certainly pass that along. Yeah, everybody, we'll put it in the comments so that that if you or people you know that want to find out what the good folks at Public Health do at the Senior Citizens Division, or if you have any questions, or just go there and say congratulations and thank you for the wonderful work that they do. So Charlene, I've often wondered, I've had the great pleasure of interviewing folks from your division a number of times over the years, and I've kind of thought, like what kind of person has a calling. I don't want to say, they choose it, or, they get placed there, or they're detailed and everything. But what kind of person has a calling to work with senior citizens and literally make that their life's work? What's the background typically? Do they come from social work, or is it just, we all take care of the generation that came before us. It's who we are as Guamanians. But what do you see as far as, the pedigree?
It's varied. We have some that have been in child welfare, social welfare services. We have some that have come in from behavioral health. I came from on the child welfare over to aging. I didn't think I was going to be here this long, but I've been here. Our other colleagues have come from behavioral health, others from other disciplines, as I mentioned, behavioral health, DISIT. Evelyn Manbusan came from our disabilities group. Some that are PCs, program coordinators, are coming from the public health side. So it just varies on an individual, I would say.
Yeah, I was interviewing Dr. Tien Trin from American Medical Center last week, and the work that he does with geriatric medicine. And he's a family practitioner, but he also does a lot with caring for seniors. And certainly it's a very specific specialization that you have to do. But what are some of the challenges that you see in being able to do your work? Obviously, manpower is always going to be an issue, but it's a very distinct type of caring that you have to exhibit.
Right, correct. But first off, in order for us to do this and provide our services, we do go through the procurement process, whether through requests for proposals, invitation for bids, or memorandum of understanding. So that's a challenge in and of itself. We do recognize that we are not able to do this ourselves. We currently are under 10 in terms of staffing at this time. We do this through our network, those RFPs, IFBs, MOUs, in terms of engagement with service providers and vendors, enable us to provide the home and community-based services. So this includes 6 supportive services, and they range from adult daycare, case management services, in-home services. Now we have legal assistance services, senior center operations and transportation services at this point. And then we've got nutrition, we've got congregate meals, home delivered meals. We have preventive health, we have the National Family Caregiver Support Program. And then amongst the other aging services, we do have our state health insurance assistance program, state Medicare patrol program. We've got our elder abuse program and our ombudsman program, and our volunteers who help us. So big part of it are those workers that are providing those home and community-based services directly. When I say directly, these are our meal delivery drivers that give our homebound seniors their meals every day, Monday through Sunday, except on 10 holidays. Our congregate meal delivery is being done now in support from our Mayor's Council of Guam, which we have an MOU with for adult daycare and senior center. So although those centers are closed, we still need to provide our COVID-19 service, and of course, providing that nutrition meal to provide for the seniors that's being provided. On the in-home service side, we do have workers who've been assessed through the case management program for very frail homebound seniors to get personal care, homemaker services, and chores. So we have seniors that may be bedridden and they need help bathing, and they not have may need help with that, or seniors that need to pick up mail and they can't move as much, or to purchase groceries and they've got no family support. They need light housekeeping. So those are just some of the range. I know we have over 200 plus of our workers. If we look at the aging network contracted plus ourselves, that's what it would be. So it's not just us, it's our partners that are out there that enable us to provide the services that we're currently providing at this time.
Well, thanks for throwing out the numbers, because that lets me segue into my next question, because I was going to say, are you able to say, just off the top of your head, if you know, like how many seniors there are on our island that you're able to provide services and, like be able to network with? And then specifically on top of that, how many are centenarians? Because each of us Guamanians have our centenarians hold such a special place in all of our hearts.
Yes, I'm pulling up my sheet right now. Give me a minute. We don't have the centenary count in our total count of seniors that receive services, but we did serve over. I'm trying to open up my. Okay, I've got it.
No problem if you know. I mean, I know it is quite a large number, and I was actually doing a podcast with your agency's director, Art St. Augustine, about a year and a half ago, before the world went crazy, and you were actually preparing for the annual Centenarians luncheon that goes on, and for us in media, it's always such an honor for us to be able to cover that, because we can celebrate the people who have lived more than 100 years, and and their families are there, and it means so much to them, and we can learn from them, and we can, with us who do stories for a living, we can go to them and we can ask them about their wisdom. And some of them said, I've been alive to see 2 world wars, or at least 1 world war, several conflicts and everything. And I mean, there's just so much rich knowledge you can glean from our island seniors.
Okay, so we just completed our what we call our aging data that was submitted to our Region 9, which is our grantor. So we look at the total clients that we serve on home and community-based services. In 2019, we went from 3,379 up to 4,342, or 28% increase. In terms of clients that we serve that were below poverty, we went from 1,412 to 1,713, or an increase of 21%.
Wow.
In terms of persons with high nutritional risk, we went from 2,239 to 2,677, or an increase of serving people with high nutritional risk of 19.56%. And in terms of significant increases, because we're looking at those that may not have access to meals that are 60 and older, we saw a huge increase, of course, in our congregate meals when our centers closed. So we went from 132,117 to 198,950 meals provided, through in line with COVID. So there was a big increase in terms of what we have faced with the division, and we're still facing to today. So I hope this helps. We don't have in our data reporting specific information on centenarians because they ask us data as a whole. So that's very different at this time. But in terms of where we're at, I know that back in December, we had the resolution of presentation of the centenarians. And I wanted to say thank you to the Office of Senator Shelton for ensuring that we made this happen to identify and address those centenarians. So there were seven, and of the seven, 6 were females, and we had 1 male. So that still continues to be our trend. I guess we were looking at trending, and that we have still more women centenarians than we do have on the male side. So hope this helps. Go ahead and
yeah, no, absolutely. I mean, yeah, thank you for the information, and I'd like to pedal back just a second because I do appreciate when you said that the volunteers that the Division of Senior Citizens has are so critical to allow you to continue the services that you provide and the programs that you administer, like the volunteer drivers that deliver the meals. If people are watching this interview right now and they would like to get involved, I know because people message me all the time and they say, like, I'd like to do this. Either it's young people and they say, I want to do it for service learning, or it might be a church group or just a family that says, I know it's the right thing to do. Even with social distancing being what it is right now, if people would like to volunteer, how do they know whether to approach public health or to go to their mayor's office?
Well, they can call us up. They can also send us emails. So let me give you the 2 numbers. And of course, after this interview, I can send you our email address, but they can contact our office at 735-7415 or 735-7421, 8 to 12 or 1 to 5. We are closed from 12 to 1. Our email address is capital B, IBA, BIBA, period, dot senior citizen.
I like that.
Yeah.
That's easy to remember. BIBA senior citizens at dphs.guam.gov.
DPHS.guam.gov, correct. And I'll send you both that contact information.
Everybody add that into your address book and everything. You're going to want to use it. I mean, it's a wonderful email address, and it's for wonderful people doing wonderful work. Charlene, as you said, you've kind of been on both sides of the spectrum. I guess you said you dealt with the younger demographic, like early in your career. What are some of the contrasts about what public health does when you work with the younger Guamanians and that people on that side of the island, and now for people who are kind of like they're retired, they're in the twilight of their lives? And
I think on child welfare, it's very heart-wrenching. The social workers that go out and they address those referrals that are coming in. I'm not a social worker, so I just want to be clear. But it is sad when you have to go in and remove children, and there are different types of abuses. The big ones being, of course, physical and sexual. Those are just up to now, those are still probably the top 2 highest types of forms of abuse. When you remove kids from their parents, you remove siblings, and if you're looking for placement and they may not be placed together, that may be also emotionally challenging for the kids. On the aging side, until I started working here, I had no idea that this division did so many activities, so many services out there for the seniors, and still continue to do so. I mean, 6 supportive services, from daycare all the way to transportation and meals and caregiver services. Then you've got elder abuse and ombudsman, and then our SHIP and our SMP, which SHIP and SMP also provide assistance to seniors and for those with end-stage renal disease to help them with Medicare counseling and access. We do have a team of volunteer seniors over 60, and they do come in. I mean, these are true volunteers. They do not receive any type of compensation with the exception of maybe a mileage stipend. And they volunteer their time after undergoing training to help us with any questions that other seniors on Medicare may have, whether it be on billings, to look at their billings, to see if they were correctly charged, and if they weren't, what can they do? So we have a group there as well that provide assistance with us in our efforts.
Well, I do know several people that I've met and several people who I'm related to over the years that have been the beneficiaries of your programs, and they have all said the same thing as, you guys genuinely have the heart to do this kind of work. You do want to make sure that, our beloved seniors are taken care of and are not forgotten and appreciated and everything. And they all say you're true professionals, and you just it's obviously this is not just a job for you. You guys really take this job to heart.
And I do want to plug in. I know you may or may not be familiar. Our current director came from this agency, the division. So a lot of the activities, a lot of the promotion on Senior Citizens Month events really came from him as the leader here. As much as we were very short-staffed, he still encouraged us to look at what is it that we need to do to get the services out and how best to promote, to make things better. So I do want to bring that out. And of course, that's Director San Augustine. So a lot of the expansions of services really came from him when he was our administrator. And of course, he really laid the platform for the rest of us. So I do need to bring that up. Thank you.
Oh, certainly. Yeah. Like we were able to cover, Art for many, many years when he was running, the conference on aging. And that was also very, very, very wonderful to do. So, Charlene, I'm thinking of an earlier interview we did. Forgive me. Is there anything else you would like to add that the community might be able to?
Actually, I did want to follow up on
Sabrina.
something on the senior citizen centers. What is the plan to get those reopened?
Right. So right now, we know we need to look at the latest CDC guidelines. We know we need to look at the latest public health guidelines. As of this morning, through email, we received communication from our grantor about reopening, and that will not be available for the next 2 weeks. So we did receive that communication. And in terms of their last messaging to us, they want to ensure that we are safe. Our seniors are safe when we do reopen. So we are also ensuring that we are, looking at all parts, CDC guidelines, local public health guidelines, and also latest guidelines from our grantor, which is the Administration for Community Living. As we know, we are still, Guam is still going through with the COVID vaccines. And so that's a big thing that we want to make sure that we look at safety also.
Does the CDC in their guidelines they are recommending that they not open?
No, I'm not saying that.
Okay, I'm asking.
Our grantor, yes, I'm not saying that. Our grantor has stated that they will be providing updated guidelines for reopening. That they have also stated that we too need to look at these latest CDC guidelines.
So what does the CDC guideline say?
I don't have on the CDC. I can tell you what I do have on our grantor site. So give me a minute.
Okay.
Their internet's kind of slow, right, Charlene?
Yeah, I don't have. It's just like a lot of information. So sorry about that.
No worries.
I know we had the mayor on earlier
Yeah.
this week, and he was talking about that they don't plan on opening it until they can get 100% capacity because there's so many
So many
medical
Mononco, and then they
yeah.
didn't want to be put in a position where how do they select because of social distancing
come.
who can come, who can't. You know what I mean?
Correct.
So it kind of sounds like it's not really like a safety protocol issue. It sounds more
Well,
like
it
they
could
want to be all inclusive. I mean, I don't know.
It could be because if reopening happens, we do have transportation, so the seniors will be somewhat congregating. So we need to ensure the social distancing on the bus. And so if the bus is a 12-pack and you can only fit safely have 3 people in, and if majority of, let's say, adult daycare is usually six clients on board, then how do we go ahead and address the other 3? So those are just other things, and maybe
Right.
I'm so just wanting to bring that up. So it's
Thank you.
also not just at the center level, but also on the transport side to
Right.
get the seniors to the centers.
Good point.
Yeah,
We
a lot
did
of
have-
things to consider.
Yeah. We had a comment here from Mary. Mary comments in on our Facebook Live feed. Any plans to promote adult foster care services? What about assisted living facilities? The cost for St. Dominic's and or caregivers is unaffordable for most people.
I can't comment on St. Dominic's. I really can't. I
Yeah.
know that assisted living is something that's being explored. I know that that's even above us. We do need to look at the funding, who's going to fund it.
Right.
That I can say. I can also say that assisted living is, we look at mainland. We did do a review a couple of years ago, and a lot of it is not funded by we have some that are not funded by the state. If it's privately funded, you see costs as minimal as $5,000 per month up to $10,000, depending on the type of facility and who is running that facility.
Yeah.
But are you seeing that, Charlene, as the trend has been, I mean, just to survive and put food on the table, everybody has to go to work. And so what we're seeing is these nuclear families, which have always included the grandparents and the elderly. Now everyone's got to go to work, and, you know, no one's left to watch Nana or Tata.
Yes, I mean, we do see that the support system is not like how it has been in the past.
Yeah.
We do know that. We know that there's not that many family support as we see. We used to see in the past we had 10 siblings. Now you're very fortunate to see 3 siblings. So to help with their parents. So I don't have access to pull my information up.
Okay.
I'm sorry about that.
It's all right. It's all right. I was just curious.
I can provide it after this
Yeah.
call. I can go ahead and share that with you, and then we can do a follow-up if you
Yeah, that'd be
want
great.
to at this time.
What about caregiver service? Do you guys offer any type of caregiver service?
Yes, through the National Family Caregiver Support Program, they provide temporary respite, and respite is where the respite worker would come in and provide respite, i.e., if the caregiver is needing to bathe the senior or their caregiver. I'm sorry, the caregiver, the respite worker will come in and do bathing. It could be chore services. It could be home light laundry type of services. So they would come in, provide that respite so that caregiver can have some time for themselves. So what's also provided with the caregiver program is they do have support groups. They do provide access for services. So if a caregiver is needing other resources that they may not be aware of, i.e. if it's public benefits, they can connect that caregiver with that type of service, public assistance. And likewise also supplemental services to help with the caregiver's needs, but that is also done through an assessment by the social worker within that program.
Charlene, I wanted to, because I know that you had said you came from working with the youth, right? And seeing some of those tragic, heartbreaking stories with abuse or, you know, neglect or whatever. What do you see on the senior citizen side of the equation? Do you see abuse and neglect out there?
Yes, there is. We have financial neglect happening. So that is up there in terms of our referrals. And if you give me time, I can pull out our APS report was submitted, and we did list our key top abuse and neglect. And I know financial abuse is one of them. So it's one of the top referrals that we've received.
Yeah, you're gonna pull that up, or?
Yes, I can pull that up. Give me a minute.
You still have my cell phone? Just send it. If you could send it over, forward me the link too. That'd be great.
Okay, I'll do that.
Yeah.
Is adult protective services under public health?
Yes, it is. It's actually, it is under a division of senior citizens.
So okay.
So we also have adult protective services
So
as
about
part of our.
go ahead while you're pulling that up. What's the process if someone suspects or knows about any type of mononco abuse?
They can call our office, 735-7415 or 7421. On the weekends and after hours, there is a number which is with our contracted provider to call. So there is an after hour number as well. So if any, and it is for not just adults 60 and older, but these are also for individuals with disabilities 18 to 59 years of age who may have been allegedly abused or neglected. So it could be physical, it could be sexual, it could be financial exploitation.
Yeah. Who's
So
calling?
that's what we do now.
Who calls those numbers?
who calls those numbers
Yeah. Is it
in
are
terms of the
the
referrals.
alleged victims, or is it family members, or neighbors?
Well, referrals come in from different parts. If the centers were open, the centers will be calling in. You may have family members calling in. Yes. Neighbors can also call in. So yes. And just suspecting potential abuse or neglect. If you suspect it, the best thing to do is to just call it in, get the information out. And of course, we would need to know who's the alleged victim, what is the contact number, what is the physical address if you were to go out, what type of abuse, who's the alleged perpetrator. That will help us as we go out to do that.
Can you define financial abuse?
Give me a minute on financial.
I mean, I know what it is, but
Oh,
and you see
I
it.
didn't bring my API. Yeah.
Yeah, but you see it though, and it's where we have a lot of our manumco are on fixed incomes or just any kind of income, where they're Social Security or retirement, and so I'm assuming it's family members or even maybe friends of the family who,
Yes,
I mean,
so-
either the manumco aren't able to get all around, but they've designated someone to handle their financial affairs, and I mean we've all seen it in different families where you get maybe a family member's on drugs, sadly, and they drain out, Nana's bank account or settlement or any type of. Is that what you see, Shar, with the financial abuse?
Well, yes, we see, we have reports of family members giving access to mom's debit cards and using it, and they're supposed to use the money to get groceries or pay the bills, but they take out more than what they should be taking out to take care of mom's needs.
And what's the remedy for that? So when you get, like, let's say someone calls and they're like, "Oh man, my brother's financially abusing our mom." What
So
happens
when
after
that
that?
happens, yeah, so when the information does come in, we go out and we do an investigation to determine if the abuse did occur. So APS does do its investigation to address that.
Is public health going to be submitting testimony tomorrow during the public hearing on Bill 100? That's the Public Defender Service Corporation.
Yeah, yes, my understanding is yes, we will be.
And this is something that's needed. Can you speak more about that?
Okay, so Bill 100, I believe it's 100-36. It's on the Outer Justice Center with Public Defender Services Corp. I do want to just ensure that it is our management will be submitting. When I say our management, talking about our deputy director or director will be submitting formal information on that. So I would not want to state more.
Okay.
Anything else? Sorry, Chris. I found the information. Oh, God.
Go ahead, gush.
Okay, give me a minute. I didn't have everything. I need like 4, I think, workstations, monitors to pull up different things, but give me a minute. So in terms of the type of referrals and we received and that what we had reported for FY 2020, the top referral that we received was for emotional and physical abuse. Then we had financial and property exploitation, and then we had neglect. So those were the top 3. I know that financial exploitation has been our top referrals for the past number of years. When I say past, it's always been one of our top 3. So when you do ask the definition, it is using a senior's, it could be their income, it could be their bank account, their finances, it could be transferring property that they may not be aware of. So that's what we look at when we look at financial exploitation.
Do you have the numbers for or the stats for last year on reports of elderly abuse? Made to
Yes, so
see-
we had a total of 111 referrals received. For the elderly with a disability, we had 97 referrals. Adult with a disability was 53 referrals. So total was 261 referrals received.
And this was last year?
Yes, last year for 2020.
Was that an unusually high number, or is that typical?
I don't have it to compare to the prior year. I can say that. So we can look at that and provide information on that.
And
We look at, because we were only reporting for last year, not the prior year. So last year would have ended on September 30th, 2020. The prior year would have been for 2019.
and out of all those cases, is there a backlog?
When you say backlog,
Like with like Child Protective Services, they had all those cases that were referred over to CPS, and it didn't appear that they were being vetted or investigated, and so the governor swooped in and declared an emergency for CPS and transferred authority and jurisdiction and operations to Melanie Brennan over at DYA. So I was just kind of curious, what was the situation with Adult Protective Services? Were there all these hundreds of referrals, and were they actually being investigated?
I think if we could we can have a separate interview with APS with.
Oh yeah.
I do have a social service supervisor, and sometimes it's best when you speak with those who
Right.
have that direct,
Let's
and
do
we
it.
can both be part of this. So we need to do a separate discussion. We can do that.
That's
We
We
will.
have
fine.
more appropriate and responsive information.
Right.
Right.
I got it.
Thank you, though.
Thank you so much, Char.
Well, thank you. And then I do have your phone number. I'd have to look at it so I can at least still share the information earlier regarding today's presentation on the division side. And
Right.
yes, feel
Did-
free to reach out to us.
Right. Did we
If
take you
there's
away from
anything
the
else that
did we take you away from the presentation, Char? I'm sorry.
You know what? I asked them to record it so I can watch it later. So hopefully I'll try and do that.
Ay, day dispenser.
That's okay.
Did they
Someone
have
has to be
food?
with-
I hope you didn't
someone
miss
has
out on
to be
food.
with, on the air. So I'm here.
And we appreciate
Okay.
you.
We do, yeah.
And if there's any more clarification, please feel free, let me know. We do want to get back out there. And if it's separate, Sabrina, on the reopening, I don't know, maybe Chris, do I give it to you through your WhatsApp or your phone number? So that at least you also have that information. Because I do want to walk away knowing that we have responded.
Yes, yes.
Char, why do you do what you do, though? I mean, I know you're a career government employee, but, being the acting senior citizens division administrator, what keeps you going? What wakes you up in the morning?
Well, it's not just me, it's everybody else who works at public health. What keeps us all going and motivated, right? Even with our, everybody is faced with resource shortage. We know that. For us, it's because it's our, it's more than just our jobs, it's making sure that the services continue, right? So that's what we need to do. The services for us is our clients, which are our seniors, to make sure that we're here and we're doing everything that we can with the resources we do to provide that service for the seniors.
All right.
Thank you, Char.
Does that help?
Yeah, that's good. That's good.
And again, most amazing.
Hold on.
Yeah, and again, most amazing email address ever, everybody. biba.seniorcitizens@dphss.guam.gov. Biba Senior Citizens Division. If you have any information about the programs they run or any of the services they have, or as Char was saying, if you would like to volunteer, certainly many hands make light work, and they could certainly use your help. So please get in touch with them if you have the calling to help our seniors.
Thank you. Thank you for your time. Thanks.
All right. Stay
Thanks,
safe.
Char.
Have a great
Text
day.
me.
You too.
Okay, that's the right on.
I'm surprised like more GovGuam agencies don't have like biba.pua or
That would be so hard, though, for reporters who need to message and email different people.
Oh man, yeah, that financial abuse, that's a big one. 939. Yeah.